Hello everyone, I am Labelda. Welcome to another insightful episode of the USTM Podcast, where we bring you expert discussions related to health, education, and awareness. Today's topic is a matter of life and death, like literally. We will be discussing on the topic related to heart strokes, what causes them, how to prevent them, and the dangerous addictions that can silently attack your heart. Our special guest today is Dr. Javed, who has dedicated years to researching and treating heart related ailments. He will guide us through the critical aspects of heart stroke prevention and shed light on the lifestyle choices that can be putting us at risk. Dr. Javed, welcome to the show. Let's begin.
Thank you, Labelda. It's my honor, it's my pleasure to be here uh, as a part of this podcast.
Dr. Javed, to start with, we would all like to know what is a heart stroke.
It's a very good question. And heart stroke is nothing, it's a clinical syndrome. As a result of as a result of insult to the myocardium, means heart tissues, and it occurs due to occlusion of coronary arteries. The blood vessels, it may be gradually occluded or may be sudden onset. So there is imbalance between supply and demand of the myocardium tissues in respect to oxygen. If there is demand is more and oxygen supply to the myocardium tissues are less as a result of atherosclerosis formation or plaque formation, that results to maybe due to chronic illness or due to sudden insult as a result of rupture of atherosclerotic plaques. It may causes sudden cardiac arrest or heart attack.
Thank you, sir. Sir, we would also like to know, why does a heart stroke happen? What are the main causes for it? And as we all know that, as we all heard that, usually heart strokes happen suddenly. Like, is that even true? And also, can you also tell us what are the symptoms of a heart stroke?
Heart stroke, actually, it may due to some chronic illness also, or maybe acute also. There are some predisposing factors or risk factors like advanced age. As aging increases, then there are chances of when patient becomes older, there are chances of heart stroke is more due to, because our blood vessels get atherosclerosed or becomes the blood narrow. The coronary arteries becomes narrow day by day, and plaque formation chances are more. So there are chances of heart attack as a result. And second, like some modifiable risk factors like obesity is one of the commonest cause. Then sedentary habits. If there is lack of exercise and people are obese and they follow sedentary lifestyle, so they are also prone. Then smoking, one of the important factor. Drug abuse, excess alcohol consumption. These are the certain modifiable risk factors. So they may predispose to heart attack or myocardial infarction or ischemic heart disease or coronary heart disease. And if we consider the chronic part, like ischemic heart disease, it's generally gradually and progressive. In within few months or few years, patient may suffer from various predisposing factors, including if he's having diabetes, he's having hypertension, or some chronic illness like infections like arteritis due to any reason, then some infections like syphilis or SLE syndrome. So in these conditions, uh, or due to some other chronic illness like anemia. So in these conditions, patient may have cardiac like heart attack symptoms or coronary artery disease as a chronic illness. Sometimes we see many patients, those who are suffering from diabetes or anemia, and if they are pregnant also, mainly in case of pregnant lady, if during pregnancy also they might have myocardial infarction. When we examine those patients, so because many poor population they are suffering from anemia, and anemia is one of the common cause, predisposing cause. Like the heart tissue needs more oxygenation, and due to anemia there is less supply because less blood can carry less amount of oxygen to the heart tissues, and as a result there is uh, necrosis of the heart tissues. Finally, that may leads to heart failure as volume overload or maybe ischemic changes, and finally patient may have death also.
Sir, can you please elaborate on the unhealthy lifestyles that contribute to heart strokes, and what are the many changes that we can bring into our habits to avoid heart strokes?
Thank you, Lavender. It's a very important question for our audience because nowadays, earlier, what we feel, okay, older people might have cardiac disease or coronary artery disease, but these days, what we have seen, like young generation also affecting very fastly. Or I think our lifestyle is very important part to become healthy, to lead a become healthy life, and to become a healthy heart. And we are these days our young generations are leading to very faulty lifestyles like sleepless night, very stressful working environment, maybe some personal reasons or family reasons, or working environment is not healthy, and that constant stress is one of the important triggering factor to become acute heart attack or acute myocardial infarction, sudden emotional upset, psychosocial disorders. Like in young generations, there are increase in number of smoking or drug addiction, alcohol consumption, taking lots of junk foods. These directly or indirectly they are affecting our lifestyle, uh, uh, and as a result, people are having uh, cardiac disorders very fastly, like hypertension of young patients, then faulty food habits, less consumption of like less consumptions of fruits and vegetables, fibers in our diet. These all, I mean, predisposed to unhealthy lifestyle. These can be modifiable to become a healthy lifestyle and become a healthy heart.
Thank you, sir. Sir, there are many people are unaware that there are different dangerous addictions that causes heart problems. Sir, could you please tell us what are those different dangerous addictions that can cause heart problems and strokes?
It's a very important point, and we have to think in our society, what we have seen like day to day life. Our youngsters, they are going out of track, and they trapped by someone, friend circles, or maybe peers groups, or some other groups, and they are misguided by uh, those groups, and they becomes drug addict. They used to addict so many abuse substances, which is very bad for healthy lives, healthy our health as well as our heart. Among them, cocaine is one of the commonest substance which causes acute narrowing of the blood vessels or vasoconstriction, and it causes toxicity to the endothelial tissues and our heart tissues, myocardium, and it leads to acute insult and damage to our blood vessels. As a result, sudden cardiac death is seen in drug abusers in our society. The second commonest cause is alcohol. In alcohol, cobalt is a very toxic substance which used as a preservative, and that causes damage to the heart tissues and leads to myocardial damage, endothelial damage, and as a result, patient suffers from sudden or maybe gradual cardiac illness. Finally, if you will not control it, it may lead to death.
Thank you, sir. Now we all know about these different dangerous addictions that we have to be careful of.
Yes.
And sir, now let's go to the next questions. That is the preventive measures. So we all know that prevention is always better than cure. So can you please tell us the most effective ways that we can prevent heart strokes? Are there any kind of specific diets, exercises that we can follow?
Yes, it's very true. Like there are certain, as we discussed, there are certain modifiable risk factors. So prevention is better than cure. It's always very true. So we can do our lifestyle modification. We can defend the modifiable risk factors like obesity. We have to control our diet. We have to think how we can maintain our weight, how we can prevent the central obesity, and other things. We have to maintain adequate sleep. We have to avoid stress factors. We have to control our diet. We have to avoid excess consumption of junk foods. Then we have to avoid alcohol, smoking. Cessation is also a very important factor. We can maintain our regular exercise, then walking, swimming, cycling, whatever we can maintain at least 5 days in a week, minimum for 30 minutes is very important to become healthy. And the second part is, like if somebody is suffering from diabetes or hypertension or maybe pre-existing comorbidities or risk factors, they have to go for regular checkup. They have to control their blood sugar level. They have to take regular medication should be taken. They have to follow the advice of their consultant doctors. Then control of hypertension by home remedies or maybe medication also. Then excess consumption of saturated fats we have to avoid. So otherwise that may causes atherosclerosis, and atherosclerosis finally leads to heart attack, maybe in a chronic form or acute form. We have to increase more fibrous diet, then green leafy vegetables, fruits, salads, then diet which is rich in omega-3 fatty acid and less consumption of fats, saturated fats. Then we have to avoid excess cholesterol rich diets. It's very important to become healthier in all respects and to our heart also.
Thank you so much, sir. Sir, the next question is actually related about stress. So we all know that stress is actually a very it's something that's unavoided in all our life. We all have different kind of stresses, and so we want to know if these certain stresses contribute to heart heart attacks and all that? And also, what are the ways that when we can manage the stress?
uh, stress is one of the very important factor, or for important predisposing factor, we can say, to trigger acute heart insult as and acute heart attack, or maybe in the form of chronic heart attack also. And it should be modifiable up to some extent. Like any form of stress, if we can avoid, our life longevity will increase and our heart become healthy. Because what happened, sudden cardiac stimulus due to any shock may lead to cardiogenic shock, and sudden cardiogenic shock may lead to sudden uh, heart attack and leads to death also. So we have to make our working environment very healthy. Home environment should be healthy. Whatever the issues, it should be sorted out, and our mind should be relaxed, our heart should be happy, and we should be also try to maintain such kind of routine work where we can become happier. If you are not happy, if you are always under stress, less sleep, overworked, so this routine should be modified. And if our mind is not relaxed, so that is also a dangerous factor for our heart. And if we can modify it, it should be better for us.
Thank you so much, sir. So now we would like to know more about the role of medications and the role of regular checkups, so that we can actually maintain a healthy heart. And also, what advice would you give to families who have a history of heart disease?
Yes, Labelda, it's a very important thing. Like, there are two kinds of treatments, either pharmacological measures or non-pharmacological measures. As we discussed earlier, all like non-pharmacological measures and disease-modifying conditions, lifestyle modifications, these play a very important role. And if we can prevent any disease up to some extent with these non-pharmacological measures, it should be, very important. And second thing is medications. We have to go for regular checkup. A patient have to go for regular checkup if they are suffering from any cardiac illness or maybe any chronic illness. They should follow the instruction of their physicians or cardiologist or diabetologist, or maybe taking treatment for hypertension. Medication should be taken on time. If they feel any kind of difficulties, they can consult or reconsult their consultants. And family member also should be aware that what kind of changes is going on, whether our patient are getting benefited with these medicines or not, or any sort of like after taking medications they are having some allergic reactions or anything. So it should be noticed. Development of the patient, any progression in disease, any betterment in their health condition, improving or not. So these are the important factors, and regular medicine should be taken. And as a preventive measure, what I suggest, if anybody is having age 40 plus, they should go for at least yearly health checkup, routine ECG, routine basic blood investigations, serum lipid profile, blood sugar level. It should be checked at least once a year. Or those who are suffering from cardiac disease or may have earlier episodes of heart attack or some sort of illness, they should regularly follow the instruction of their doctor, lifestyle modifications to become healthier, and like yoga, pranayam, meditations, listening music, then whatever the exercise like swimming, cycling, or walking. These are the basic tips which we can do easily at our doorsteps. So this should be, done on regular basis, at least 5-7 days, at least 5 days in a week. These yoga, pranayama, and all should be done, and medicine instruction should they have to follow properly, and it should be monitored by our family members or their family members, so we can do in better way to
Yes.
keep ourselves healthier and happy.
Thank you so much, sir. Sir, before we conclude, I would like to ask you to give us one piece of advice to our listeners, to everyone around, about the prevention of heart stroke, and what would be your very main piece of advice regarding that?
Yes, it's now take home message is like this: healthy heart for healthy body. If our heart is not healthy, not happy, our body never become happy. And whatever the disease modifying conditions or lifestyle modification, if we can follow in our day-to-day life, it will be very important for healthy heart and healthy life. And regular follow-up, regular checkup, regular following the instruction of their doctors is very important. And if they face any kind of difficulties, they can consult the doctor at any moment, and it should be followed regularly. Thank you.
Thank you so much, sir. Sir, we would also like to know what are the common symptoms that are seen in people as a symptom of heart attack.
Yes. It's very important, like how we can identify that or recognize that patient is having heart attack. Many patients, they might have chest pain, severe chest pain, like squeezing type or heaviness in the chest. Sometimes what happen, this fist, patient might come like this, okay, or we might have seen that patient is having in their epigastrium or lower part of the chest, they have fist putting like this, sir, I'm having very severe pain. Such kind of patient may, and many patient, they present with simple vomiting, maybe simply like epigastric pain, or maybe some other symptoms. Sometimes patients are asymptomatic, like diabetic patient. Diabetes is called as a silent killer disease. So many times the patient may not have like severe chest pain. They just came for routine checkup or some discomfort in their chest. So that time when we do the clinical examination, then we find out patient is having heart attack symptoms, or he is developing heart attack or myocardial infarction, maybe acute or chronic form. So what happened, like many patients, they may present with, sir, I am having palpitation, okay, maybe sweating, associated with sweating, and the classical features, the chest pain, it may last to 2 minutes to 30 minutes duration, and it's retroesternal pain or centrally localized pain. It may radiates to left arm, jaw, teeth, neck, even upper part of the back. So we doctors, what we think, okay, any pain starting from upper part of the umbilicus up to the eyebrow, either front or back, it should be considered as cardiac pain unless until it's proved otherwise. Sometimes what happens, we do the ECG of the patient, that is the preliminary test or basic test. So sometimes the ECG is very normal. It doesn't mean the patient is not having cardiac issues. So sometimes we keep patient under observation. We do the ECG, we do the echocardiography to confirm the diagnosis, and cardiac biomarkers test is done. So initially, some patients may not have all those features, but that it's how its experience and or expertise can diagnose. But these are the common features which alarming in our mind that patient might have heart attack, and then we think in that.
Dr. Javed, thank you so much for today's discussion. It has been a very eye-opener for all of us. Now we all know what is heart stroke, what causes it, how we can prevent it, and what are the lifestyle changes that we can bring. Thank you so much, sir.
Thank you, Labelda. It's a great privilege for me also to become the part of this podcast. And if our society will get at least little benefited also, so it will be very helpful for us also, and it's very satisfactory for us that we have done something for society.
Yes, sir.
Thank you very much.
Yes, thank you, sir. To our listeners, remember, your heart is in your hand. Make the right choice, prioritize your health, and spread awareness among your loved ones. If you found this discussion helpful, share this podcast with your friends and family. This is Labelda signing off from the USTM Podcast. Stay safe, stay healthy. See you in the next episode.